Dr. Mike, how are you? Okay, I'm going to be doing a general scan today, basically from the back of your neck to about the belt line. If I need to expose any skin in that area, is that okay with you?
Yes.
Great. Could I have you sit right there, facing that way?
And could you take your shirt off for me, please?
Just relax your head forward for me. Okay. Okay, can I have you cross your arms for me? Thank you. So, we're going to go into extension. Okay. Time. Okay. Lean forward. Lean back. Okay, lean forward one more time. And lean back. Okay. Have you flexed this area? Time. Okay. If you rotate. Okay. One more time. Okay. Other side. Flex. Rotate. Okay, good. Now we'll just take a look. Okay. All right, cross your arms for me. Okay. Forward. Go back. And go forward. And go back. Okay, I'll have you laterally flex. Okay, have you laterally flex again. Okay, I'll have you rotate. Okay, rotate one more time. Okay, now we're going to do the other side. Have you laterally flex. Okay, one more time. Okay, rotate. One more time. Okay. Do the ribs. Let's do the other side first. Have you go forward. Forward. Okay. Other side. You have to do both. So, I'm going to hold press first. your head forward. Okay. One more time. Okay. Extend. Okay. If you rotate your head this way. Okay. Okay. I'll have you laterally flex towards me. Okay, other side. I'll have you rotate this way. Okay. Laterally flex. Turn. Okay. During my general scan of the thoracic spine, I found that T7 required further evaluation. The segmental contact point that I used was the interspinous space of T7 and T8 during extension, and the line of drive was posterior to anterior. For flexion, the segmental contact point was the interspinous space of T7, T8. The line of drive was posterior to anterior. For lateral flexion, the segmental contact point was the lateral aspect of the T7 spinous process, and the line of drive was lateral to medial. For lateral rotation, the contact point was transverse process of T7, and the line of drive was lateral to medial. For rib elevation, the contact point was the posterior inferior head of the 7th rib, and the line of drive was inferior to superior and slightly posterior to anterior. For rib depression, the contact point was the posterior superior head of the 7th rib, and the line of drive was superior to inferior and slightly posterior to anterior. For the thoracic area, there was a right lateral flexion restriction of T7 vertebra. Since during my general scan I found no issues in the cervical spine, I decided to further evaluate the C3, C4 area. So the segmental contact point for flexion was the interspinous space of C3 and 4. The line of drive was anterior to posterior. For extension, the segmental contact point was the interspinous space of C3 and 4, and the line of drive was posterior to anterior. For lateral flexion, the segmental contact point was the lateral aspect of the C3 spinous process, the line of drive was lateral to medial, and for lateral rotation, the segmental contact point was the articular pillars, and the line of drive was medial to lateral. No restrictions were found. So since I wasn't able to find anything during my general scan of the lumbar spine, I decided to evaluate the L2, L3 segment. The segmental contact point for flexion extension was the interspinous space of L2 and 3, and the line of drive for extension was posterior to anterior. For lateral rotation, the segmental contact point was the mammillary process, and the line of drive was posterior to anterior. For lateral flexion, the segmental contact point was the spinous process, and the line of drive was lateral to medial and slightly posterior to anterior. No restrictions were found.